right. I'm sure you've all heard like on the news recently that that the health officer of Alberta had to issue an apology because apparently she said um, how like a teen like died because of COVID, but actually like it turned out like it wasn't the cause of death wasn't COVID. It was something else. So I'm gonna pull up an article that explains it all. So this is an article from the National Post. It says Dr. Deena Hinshaw apologizes and says Alberta teen didn't actually die from COVID. The pain of losing a child is terrible enough without having that loss compounded by public debate about the circumstances. I'm sorry. Then it says Dr. And this is a picture of Dr. Deena Hinshaw. Apparently, she's the Alberta Chief Medical Officer of Health. So this is a picture of her, and it says Dr. Deena Hinshaw. So it says Dr. Deena Hinshaw, Dr. Deena Hinshaw, Alberta's top doctor, has walked back the government's previous claim that a 14-year-old had died of COVID 19 and said the province will no longer announce COVID 19 deaths for children under 18 until a review process has been completed to verify all the facts. On Tuesday, Hinshaw announced that a 14-year-old was one of 33 new COVID 19 deaths reported over the long weekend, but that the teen also had complex pre existing medical conditions that played a significant role in their death. In her announcement, Hinshaw gave no further details about the child's death. It would have made the 14-year-old the youngest Albertan to die of COVID 19. And here's a tweet from her, from Deena Hinshaw. It says, and sadly, people continue to die due to COVID. Since Friday, now an average of 8 new deaths per day were reported to Alberta Health. I extend my condolences to the loved ones of all these individuals. Today's reported deaths include a 14-year-old with pre-existing medical conditions. I'd like to be clear that this tragic outcome is incredibly rare for children. Unfortunately, it can occur particularly when individuals experiencing other complex health considerations. So I think this is what she initially said about the the child or the teen dying like from COVID. So I think this is like what she initially said. So now she's had to like apologize for this. Now it says Hinshaw's clinical delivery led to immediate condemnation on social media, with critics saying she was demonizing the child who died and minimizing his death by mentioning pre-existing conditions. Rachel Notley, the leader of Alberta's opposition New Democrats, wrote on Twitter telling their loved ones that there were other health complications that contributed to their death, offers no comfort whatsoever. No matter what pre-existing conditions they had, this child died during a fourth wave that was preventable, Notley wrote. As it turns out, the child did not, in fact, die of COVID 19. In a Facebook post, Simone Spitzer said the 14-year-old was her brother and that he was dying of brain cancer, but had been diagnosed with COVID 19 2 days before his death. So it says he died from stage 4 brain cancer. So it says he died from stage 4 brain cancer, not from COVID, Spitzer wrote, linking to a news story about the death. This is fake news. Then it says on Wednesday, Hinshaw clarified that while the initial report of the death of the child included COVID 19 as a secondary cause, new information indicated that COVID 19 was not the cause of death. She apologized directly to the family. The pain of losing a child is terrible enough without having that loss compounded by a public debate about the circumstances, Hinshaw wrote. Hinshaw said, I'm sorry if the people I spoke about I'm sorry if the way I spoke about that death made your grief worse. Hinshaw said reviews of deaths are done in the case of uncertainty, and if it's found that COVID-19 is not the cause, the death is removed from reporting. Or if COVID-19 is later found to be the cause, then those deaths are added to the reporting. She explained that COVID-19 deaths are classified as such if COVID-19 is a primary or secondary cause, as well as in cases where there was a diagnosis, but the final cause of death is under investigation. We have chosen to focus on being as timely as possible in the interest of transparency, Hinshaw said. Alberta will now review all deaths of those under 18 prior to releasing this information. It is clear that we need a different process for young people, Hinshaw said. Throughout 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 the pandemic, Alberta has reported comorbidities alongside COVID-19 deaths. For example, nearly 83% of those who have died from COVID-19 in Alberta also had hypertension. While such transparency is touted as a way to explain the risks, if you have certain health conditions, you're at greater risk of severe illness or death from COVID 19. Critics have suggested such information downplays the deaths. To those who believe that the numbers are not accurate, I would say that the process that we follow takes very seriously the responsibility of ensuring the deaths we report do have COVID as either a primary or secondary cause, said Hinshaw. In December 2020, Hinshaw said the purpose of comorbidity reporting is to provide additional information to Albertans and help them evaluate the risk of COVID 19. I want to be clear the presence of any chronic condition is not a death sentence and should not be. So whether or not an individual who passed away had a chronic condition or not does not mean that that death was less tragic, she said. And so that's the end of the article. I'm sure there's gonna be like lots of questions about like how they're like how Alberta's like gathering their data and all that. So yeah, I'm sure like a lot of people are like really annoyed about this, especially the parents of that child who recently died. So So yeah, I'm sure there's going to be lots of questions about how like Alberta Health, like how they gather their data, and it, like if they're actually um if they're actually properly gathering their data, and they're not just like calling any like type of incident like a COVID death. So yeah, I'm sure like there's lots of questions about that, and I'm sure especially like the parents of the child isn't going to be too happy about like when she said like how 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 like their kid died from COVID when it was actually like brain cancer. So it's not a good look for Alberta Health. So and she also and in this article she sort of like she like gives out like sort of like a half-hearted apology. It's sort of like the type of apology that politicians give when they're caught doing something that when they're caught doing something wrong, or they're caught doing something that they're not supposed to do. So yeah, it kind of felt like a half-hearted apology from her. So yeah, so this is the end of the article here, and we can close that now. And there's also like a video of her like issuing an apology as well. So I can let me pull that up right now. Okay, so this is the video where she like makes the apology, where she this is like yeah, so this is the video where she apologizes for saying like the teen died from COVID when that was false. So I'm gonna play the video right now.
I first want to apologize to the family of the 14-year-old whose death I spoke about on Tuesday. The pain of losing a child is terrible enough without having that loss compounded by a public debate about the circumstances. I am sorry if the way that I spoke about that death made your grief worse. Since the start of this pandemic, I have heard from many Albertans, including those who have lost a loved one. I reflect often on the impact that our reporting, measures, and every other element of the pandemic response has on them. When I speak about cases and our reporting process, it is not to diminish the losses, whether caused by COVID or anything else. At the same time, we are in a global pandemic. We have an obligation to monitor and report deaths from COVID-19 infection and to be as timely and transparent as possible. In our reporting, we always include all deaths that have COVID as either a primary or secondary cause of death, according to the healthcare teams that were involved in the cases. For example, a primary cause would be someone in whom COVID infection progresses to pneumonia, and this is the direct cause of death. A secondary cause could be a case where someone with a severe underlying illness, such as heart failure, gets COVID, and the infection makes their pre-existing condition worse, leading to death. We report in this way to accurately capture the impact that COVID-19 is having. That is also why our reporting process includes both deaths that come to us where a person has COVID listed as a primary or secondary cause of death, as well as cases with a recent diagnosis of COVID where the cause of death is still under investigation. To make sure we are as accurate as possible, after a death is reported, if there is uncertainty, it is reviewed to validate our information. If that review identifies that COVID was not a primary or secondary cause of death, it is removed from our totals. Every surveillance system has to balance this tug-of-war between precision and timeliness. The more precise reporting is, the slower it is. We have chosen to focus on being as timely as possible in the interests of transparency. Sometimes, though, as in the case reported on Tuesday, the initial information provided to us changes after a review. While the initial report of the death of the 14-year-old included COVID as a secondary cause, we have now received additional information that indicates COVID was not a cause of death.
Building hardware sucks. These days, with masks and social distancing, along with crazy long lead times on PCBs from China, it
So yeah, that was the end of the video, and yeah, like basically she was just saying she was basically just explaining like how like Alberta Health like does their like manages like their data and all that. So but I'm sure like there's gonna be questions because it looks like now they'll put like anything as COVID. So like maybe like if someone were like in a car, if someone dies in a car accident, that would be um like considered like a COVID death, or if someone like commits suicide, maybe like that would be considered a COVID death. So yeah, like there's lots of questions about like how like Alberta Health is like designating their data and all that for all these like for all the people who 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 die like from COVID, or like who die from other like problems. So I'm sure like the parents of that teen, like they aren't gonna be like too happy to find out like if like they aren't gonna be happy like if they find like when she said that like their kids like the cause of their kids' death was from COVID, but I think it just shows like how I think they're using like how like the governments, they're just using anything at this point as COVID. So like car accident, does someone dies in a car accident, it's considered COVID. If they maybe commit suicide, that's considered COVID. So I think now they're just using like anything now to like ramp up like the numbers. So like they call it like cases, but like they're actually supposed to call it infections because the term case, it doesn't actually exist in like the health industry. So they're actually supposed to use the term infection, but for some reason they're not using that. So I think like it shows that they're trying to like use I think they're trying to like use these like they're trying to like use these like deaths to like these deaths from other causes to like ramp up like the COVID numbers, to like to say that to like tell people that that like the cases are up and all that. but I think now after like reading, after showing the article and the video, I think like now people are gonna have like doubts like whether like the governments are like properly reporting like their data and all that, or if they're like trying to like they call like fudge the numbers. So yeah, so that's everything I want to show, and I hope people start like questioning this, and yeah, and and yeah, that's everything I wanted to show. So, because now like they're trying to use chill, because it's like they're trying to like politicize like the death of a child or a teen, depending on how you look at it. It's like they're trying to like politicize it now. So like I hope people start to like question this stuff, question like this, and like start to like push back against these like push back against like what they're what like the government is what the government is saying and all that. So as like I don't think they're being like very truthful in what they're like telling the public. So yeah, that's everything I wanted to show, and no, I'll be signing off now.